When I was in nursing school and I was getting ready to graduate, I kept thinking about what was I going to do upon graduation, and everybody was headed towards the hospital setting. But as a young mom, I didn't think that I could do that kind of work schedule and still support my son's education. So I heard about this new grad residency. I looked into it, and it felt like it was the right fit for my home life.
I went to home care by accident. Actually, I was working in a nursing home at the time, and I was working night shift. When I got off of work, my friend says, "Hey, let's go to a job fair." And we were both hired on the spot. After I started, I realized that this is the field for me. I don't want to go back to a nursing home. I don't want to go back to a hospital. It really satisfies me as a nurse.
I chose home care because I came from a nursing home for 15 years, and I felt like I needed a different feel of a one-to-one experience with a patient.
Because I was already familiar with the home setting in the role of being a home health aide, it gave me that extra edge to, transition into being a nurse in the home care.
I like to try something different because home care is totally different from the hospital. Totally different. It's like two different worlds, and I like it.
My average day is 8:30 to 4:30. So I start calling my patients around 8:30, looking at the assignment. Some patients want early visits. Some patients want later visits. It may be a full day where you have about 10 patients, or you have like a short day where it's about 5 to 6.
My day is different. Sometimes I leave the house at 8. Sometimes I don't leave till 10 o'clock in the morning. It all depends on where my patients are and what time they want to be seen. Sometimes I have such a big break between my patients, I can go to the gym during my lunch.
My average day starts with me coaching the new nurses on their day and their schedule, helping them to organize and plan. Sometimes I'm doing educational training, but I love going into the field with the nurses. That's my favorite thing to do, is to make co-visits.
It's very rewarding because you get to build your own schedule, you have flexibility, and also you get to interact not only with your patient on a one-on-one, but you also get to interact with the family as well.
For me, it's high level of satisfaction. When you see patient is healing nicely and patient can function, it is reward for you.
Home care is very rewarding. It's a special branch of nursing that is very unique in its ability to give you experiences that you wouldn't have in any other setting. Every patient you meet, every family that you interact with gives you a piece of knowledge, learning about yourself, learning about them, something that you could never get elsewhere.
On a daily basis, our tablets and our smartphones. We email, we text, we call the team members, our supervisors, our physical therapists. We even have a wound care app where we upload a picture of the wound, send it to the specialist, and they'll tell us what we need to do is our next step.
I like the communication tools that I use because it's fast, efficient, easy, and less time consuming. And in this way, I get to spend more time with my patient.
You have to be patient. These are patients after all. They are sick, they need the time, they need the care. You have to be curious and creative, but also persistent.
Communication and compassion. With communication, you gain trust, you gain understanding, and compassion in terms of giving great care to make sure that the patient achieves their goals.
You need to be able to calmly assess a situation, take in everything, and make a decision at that moment. You really have to know how to act in every situation and how to respond.
You need to have a lot of empathy. You have to give the same amount of care for each patient that you see a day. You have to treat your patient with respect. And this is very important. When patients feel comfortable with you, it's success to your goal.
To be successful, you need to be thinking on your feet, to be independent, and to talk to your RNs, your social workers, your field managers. It's a team effort.
The collaboration of the interdisciplinary team is very, very important in the care of the patient. The pharmacist, the physician, the occupational therapy, physical therapy all come together to form one team. Not one person alone can help that patient. It always takes a team.
We all work together with the same patient, but we all have a different focus on that patient, and we can collaborate, and each person brings their own skill set to the table.
Maybe the patient is unable to cook their own food. You'll have a social worker implemented in the patient care and say, okay, you know what, we're gonna have Meals on Wheels deliver food to the home, and see if you qualify for a Access-a-Ride to go to your doctor's appointment or even an errand run.
As the nurse works in a particular community for a period of time, you get to understand that community's resources and how they would apply to each patient in certain circumstances. It's good to share ideas with your teammates to find out like who has a home visiting podiatrist that could help this patient, who has experience with this senior center, and so being a part of the community helps you serve the people living in that community.
Home care and community nursing will become more and more important as our society evolves because it is a lot less costly providing home care than hospitalization.
I think home care has always been vital. I just think that it hasn't gotten the attention that it really deserves. And now in the last few years, more than ever, it's starting to. I believe that with more skills being performed in the home and not in the hospital, it will continue to grow and be seen as more of a valuable resource.
Home care nursing is special and unique because of the one-on-one interaction with patient and the family. In a hospital setting, it's more fast-paced, so you do not get that time to dedicate that care that the patient needs.
I believe home care is special because by entering the home, you're really seeing a complete picture of what this patient is like. And because you're allowed this freedom, you can do a better job teaching them to help them get better faster and hopefully make a more lasting recovery.
We get to meet patients on such a personal level. Going into somebody's house is the most personal place that you could ever connect with them. And they're very vulnerable in that state, but they want to reach a goal towards some sort of independence to get their lives back on track. And we're able to effectively come in there and work with them on that intimate level and help them to achieve that goal.
If you work in a hospital, you have patient on your shift, you come to next shift, patient gone, you don't know what's going on with this patient after that. When you got patient in home care, you see patient from the first day that he come until he is totally improved. And this is like your satisfaction when you see patient came with 5 wounds and discharged with no wounds. That makes me happy.
Home care nursing is very unique because you have that one-to-one relationship with a patient. And during that process, you look at picture frames and you look at all the family there and they want to get to know you. You become a family member to them. And that's why I love providing home care for my patients.